Germany has brought in its strictest measures yet to battle coronavirus as Europe fights to control the spread of infections over the holiday period. Even countries previously spared the high death toll are now struggling with how to manage the crisis at a time that families traditionally come together to celebrate. Germany has now entered a hard lockdown until the 10th of January, with schools and non-essential businesses closing after a record 952 deaths were reported in the last 24 hours. Here in the UK, 60% of the population is now living under the country's maximum level of COVID restrictions, known as Tier 3, since midnight on Wednesday. Italy is considering a further tightening of measures over Christmas as the daily death toll remains close to 500. Italy's now overtaken the UK as the country with the highest death toll in Europe. Jenny Hill reports from Berlin.
There's little festive cheer as Germany prepares for a Christmas in lockdown. As shops, schools and hairdressers closed this morning, another miserable milestone. More than 950 deaths recorded in a day. Even taking into account statistical fluctuations, it's the worst death toll here since the pandemic began. Yesterday, shoppers thronged the streets ahead of the lockdown. Most surveys suggest think it's the right course of action.
We worry about the elderly in my family as they are at higher risk than we are. I'm very pleased to see the new plan because the measures taken so far have not shown good outcomes.
Germany closed its bars, restaurants, arts and leisure facilities 6 weeks ago, but that did little to stop the spread of infection. This country's health system may be robust, but it's under real pressure. Some hospitals have had to turn patients away.
If you ask me, it's absolutely the right time to lock down. Hospitals here are at breaking point. We've already had to transfer patients because we don't have any more free beds.
So what's gone wrong for the country which came so successfully through the first wave? Scientists aren't sure, though some blame regional politicians who resisted Angela Merkel's calls for a tougher nationwide response earlier in the autumn.
I assume that people do not follow all the regulations that were told. I mean, we had to reduce our contacts by about 75%, but I think that didn't work.
There's frustration too. The vaccine developed by German scientists has been rolled out in other countries. Here, they're still awaiting EU approval for use. It's hoped that'll happen before the end of the year, but for now, a country which loves its festive traditions has all but cancelled Christmas. Jenny Hill, BBC News, Berlin.
So, tough restrictions in Germany, but at a time that families are desperate to see each other. How do we balance government restrictions with personal responsibility for our own and others' health? To find out, I spoke to Sir Carrie Cooper, a professor of organisational psychology at the University of Manchester.
Well, I think we have mixed messages, don't we? I mean, on the one hand, we have governments saying, have Christmas for 5 days with certain constraints, only 3 families together. On the other hand, we have public health officials saying, this is not a good idea. There'll be a second spike in January. This is very dangerous. And by the way, we have other public health officials who are saying, probably a minority saying, well, for the mental health of the nation, we need this, for the elderly who are lonely, for grandchildren who want to see their grandparents. So there's a mixed messaging going on. It's not as clear cut, it seems to me, as Germany and France, where they said, that's it. We're going to have to wait till January to do this. So I think that's creating difficulties. But basically, it's a risk assessment situation we're all in now. Because of the mixed messaging, we're all having to make our own decisions, personal. What are the risks for me? What are the risks for my family, the elder people or the people with underlying health conditions in my family? And it's a risk assessment that we're all going through to decide, well, should we go down and see those relatives? We have some elderly relatives. That's problematic. Do we go by public transport? Do we go by car? Are we going to go at all? Should we stay at home? I think really it's been left up to us personally. And the phrase is use your common sense. And I think common sense is great if you have common sense and you do your own personal risk assessment, not just for you, but for your other family members, then it will work. And if we have enough people using their common sense, I think we could manage this process. The difficulty is we have different kinds of personalities. We have some people who are very risk averse, and they'll probably just stay at home.
And therein lies the problem. We have different personalities and different views, most likely within the same family groups. And at a time of year when people generally get together, it's also a time of year when people generally have disagreements over one thing or another. And this has the potential to spark some conflict, doesn't it? When people may disagree on whether it's safe to meet up and others feel that it isn't. How's best to navigate that?
I totally agree with you. I think that's what's going to happen. There'll be within a family people who are very risk averse are going to go to the family, but are worried about how the other members of the family are going to operate, and particularly operate the week before Christmas, because that's the time at which they could get the infection. And for example, children could be asymptomatic and so on. They're still mixing with other kids and the like. So I think you're right. Even within a group, a family group, we're going to have that kind of issue. I think each of us is going to have to make our own risk assessment, given there is no clear-cut answer, either by government or public health, although they do have answers, but the answers are different answers. And therefore, every one of us is going to have to use, quote, our risk assessment common sense to decide how we're going to manage this. But I think it may be very problematic even within families during that 4 or 5 day period if you go to see your family.
Professor Sir Kerry Cooper speaking to me a little earlier.